newly formed Oregon Cannabis Clinicians Group joined the American Cannabis Nursing Association in Salem, Oregon, February 18, 2020, at Oregon's State Capitol Building to advance excellence in cannabis clinicians' practice through advocacy, collaboration, educational research, and public policy development.
My background goes back a couple decades of supporting hemp production and being in the fabric industry and trying to implement hemp into the athletic apparel industry decades ago. And then following that industry through the decades, about 7 years ago, I ended up with cancer and explored using cannabis to manage my symptoms and side effects for nausea and vomiting for my cancer treatment, and got some misinformation from the dispensary that put me in a position that was really frightening. I took too much THC. It scared me, and I thought I was going to end up in the emergency room. There was just a lot of fear of the position I had gotten myself into, and felt like as a cancer patient that I shouldn't have to be living in that space. That if I would have been able to have access to someone who would have educated me on cannabis and how to use it, whether it was THC or CBD or what ratio to work with, instead of getting my information from a 27-year-old kid that was wearing his hat backward at the dispensary, whose intent was good. He just had misinformation and didn't understand the dosing. So as a result, I decided to advocate for oncology patients in the Providence system. I work within the Providence system. And so I went to the ethics board, the regional ethics board for Providence, and asked them to support the education of clinicians so that we could support the oncology patients. And Providence said, no, under no circumstances will we educate our clinicians. It's illegal. If we find out that patients are using it, we'll pull their pain medications. So that kind of sent me underground and doing research. And in the course of doing research and kind of watching the various conferences, I slowly started hooking up with other nurses that were involved in trying to bring education to the patients, which is what I align with, is educating our patient population who is using cannabis medicinally. The main message for me is that for the patients is that it's a really complex working with it. It's not just going to the dispensary and getting flower or getting an edible and using it. There's a lot more to it. What cannabinoid they're using, whether it's THC or CBD or CBG or THCA, it's pretty complex. And it took me years to kind of cipher out and look at the research, because there's substantial research out there, even though it's being withheld or not being published domestically. There's research that's coming out of Israel that's really profound as far as the results, positive results, in helping migraines and fibromyalgia, MS, and kids with autism. So the message is that I guess I want patients to feel empowered and to be able to have access to the education. I feel it's important because I've been on both sides of the bed.